Alrighty, so I'm going to be doing my IV medication administration. So here's where my computer's going to go. So there's nothing on there I can cheat from. Nothing by the mannequin. Nothing on me. And then here's my workstation with all my supplies. So I got my MAR, my medication, 3 syringes, tape, alcohol swabs, gloves, and then the Betty book so I can check for compatibility and the push rate. Let's get into it. Alright, so the first thing I'm going to do is I'm going to check my order. So I see that Bob Owens here has Razapam 1 milligram IV push every 3 hours for anxiety. So I go to Pixis, get my medication. It is Lorazepam 2 milligrams and 3 mils. I'm going to wash my hands and I'm going to waste it now. So put on my needle access device and waste. Oh, I'm also going to check if he has any allergies, which he doesn't. So okay, so now I have it's kind of hard to see, but 1.5 of the 2 milligrams and 3 mils, and he's going to be getting 1 milligram. So now I'm going to be doing my 5 rights 3 times. So we have Bob Owens, 922.33, getting Lorazepam 1 milligram IV to push over 2 to 5 minutes at 12:20. Bob Owens, 922.33, getting Lorazepam 1 milligram IV push to push over 2 to 5 minutes at 12:20. Bob Owens getting birthday 922.33, getting Lorazepam 1 milligram IV push to push over 2 to 5 minutes at 12:20. I checked the Betty book again for any compatibility. It's compatible with his medications, and it says to dilute it in some saline. So I'm going to get my 10 ml flush. Get the air. Dilute my medication. And get rid of all the air bubbles. So now I'm going to label my medication with my tape here. So I have my 10 mils of Lorazepam, 1 milligram and 10 mils. Okay, so now that I got my medication, I labeled it. I'm going to wash my hands again, introduce myself. So say, hi Bob, my name is Zach. The doctor has ordered some Lorazepam for you to go in through your fistula. Could I just get your name and date of birth? He says Bob Owens, 922.33. I check his wristband. It checks out. I'm going to provide for privacy, and once again, I already explained the procedure that he's going to be getting medication in his fistula. So now I'm going to put clean gloves on, and I'm going to check his fistula, check the site, make sure there's no redness, bruising, it's not infiltrating anywhere. So it looks good. I'm going to now grab my flushes. So here's my pre-flush. I'm going to clean off my site. connect it to the tube, and then unclamp it. So now I'm going to flush it, and since it's official, I'm going to be pulsating the flush. Okay, that's one in there. Oh, it fell out. Yeah, it did.
Yeah, it just like sits together like this.
Okay. I'm going to clean my site again. And now I'm going to use the medication, which has to be pushed over 2 to 5 minutes. So, like I said, 2 to 5 minutes. Slowly pushing it in. I'm just going to speed it up for the time being, but I would obviously push it in over 2 to 5 minutes. Pulsating again. And I'll do my post flush. Once again, cleaning the site. And so, with the post flush, for the first 5 mils, we are going to flush it at the same rate as the medication, so over 2 to 5 minutes. So once again, I'm just going to speed it up, but I would flush it for 2 to 5 minutes for the first 5 mils. Okay, once it hits the 5 mils, I can flush it regularly. Once again, pulsating, because it's the Picc line. Okay, and then I would disconnect the tube, reclamp the Picc line. There we go. Then I would clean up my supplies, take my gloves off, wash my hands, ask if Bob here needs anything. He says he doesn't need anything. Give him his call light, leave the room, wash my hands again, and then document giving the medication. Some lifespan considerations could be that different age groups, you may have to push the medication slower. Obviously, with the Picc line, we're going to want to be looking for any signs of infection, as well as skin integrity, making sure that's okay. And yeah, fun stuff.